Hello and welcome MVMA members. Thank you for joining today's Lunch and Learn webinar, What Does Research Tell Us About Calf Auto Feeders with Dr. Whitney Knar. I'm Nicole Cass, CE Program Manager for the MVMA, and my role is to moderate the Q&A. A quick review to help you navigate the webinar functions. Please note that depending on the type of device you are using, you do have the opportunity to minimize the various boxes and make the slides larger. And note that the Q&A icon is where you should submit your questions at any point during the session. If you're not able to find those icons, hover your cursor over the bottom of your screen and it should appear for you. I'm delighted to welcome today's speaker representing the College of Veterinary Medicine at the University of Minnesota. Dr. Knar developed her love of the dairy industry while an undergrad at the University of Vermont. After graduating with an animal science degree, she continued her education at the University of Pennsylvania School of Veterinary Medicine, earning her VMD in 2010. She then completed an internship and residency in ambulatory and production medicine at Cornell University in 2013. She completed her PhD under the mentorship of Dr. Sandra Godden, as many of you already know who she is, at the University of Minnesota. And then she joined the faculty in the fall of 2017 as an assistant professor of dairy production medicine, where she splits her time between teaching and research. Whitney's teaching interests include animal welfare and behavior, dairy production medicine, and small ruminant and camelid production medicine. Her research interests include young stock health management, dairy cattle behavior and welfare, and the use of precision dairy technologies to predict and detect disease. Please go ahead, Dr. Knar.
Thank you very much, Nicole, for that introduction, and thanks to Dr. Dodd and the MVMA Food Animal Committee for this invitation. I'm going to keep my camera off just to facilitate the sharing of content and video, and we'll go ahead and get started. Nicole, can you just confirm that you can see my screen?
Yes, it looks great.
All right, sounds good. All right, so today for the next 30 slides or so, or 45 minutes, we're going to be talking about sort of up-to-date information and new research, at least within the last 5 years, about auto-feeding calves. So this is the first in a three-part series where Dr. Lee Michaels is going to talk a little bit about their dairy's decision to transition away from auto feeders, and then a producer is gonna round out kind of the trio to talk a little bit about some successes that they've had auto feeding their calves on their dairy. So without further ado here, just so we're kind of all on the same page. This is a very simplistic diagram, but I just want to make sure that we all are understanding what we're talking about today. So basic computer feeder, we have a calf with an ear tag or a neck collar that identifies her or him if we're feeding bull calves, goes into the auto feeder, goes into the stall, tag is red, and then we feed if the animal has an allocation, we feed a milk meal out. And so we can feed milk replacer, we can feed pasteurized whole milk, waste milk through these systems. And typically these systems are being used on approximately 16% of Canadian dairy farms, according to a big survey study done a couple years ago. And then according to the NAHMS data, or the National Animal Health Monitoring System, their last dairy study in 2016, approximately 14% of calves in the US are being fed in a group situation. And certainly in the upper Midwest, we do see a lot of auto feeder herds. And so just again, some basics here. We have sort of three different types of systems. We have the Forster Technic machines, and those are any Delaval, Gia, or Lely machines. We have urban feeders, here in the middle, and then we have the home and Lao feeders there on the right side of the screen. And most of these feeders, we have one machine which is feeding out to 2 pens, and usually 2 pens, 2 feeding stalls one feeding stall per pen. There are some systems, the urban and the Forster Technic machines can feed out to 2 stalls per pen as well. So there we go, very basics, just so we're on the same page of what we're talking about today. And so when we think about the benefits of group housing, the way I like to think about this is that we have some calf benefits and we have some management benefits, and this is in relation to individual feeding of calves. So we're really comparing group versus individual feeding. And so for the calf, we can really facilitate high feeding levels. And so it's when we think about feeding more than a gallon of milk twice a day in an individual setting, that becomes, when adding a third feeding, that can become very labor intensive. And so the beauty of the auto feeder is that we can feed more milk without a lot of extra labor involved. And so that's what this graph down here is showing. So this, again, this is a big Canadian survey study where they surveyed AMF herds, so automatic milk feeder herds, and MMF, so that's the manual milk feeding herds. And you can see that the what's represented here in these bars, so we have milk offered in liters per day, and the bar kind of in the middle of that, of each box plot here is the median milk. And you can see that in the manual milk fed herds, we have pretty consistent milk feeding over the pre-weaning period. But in the automatically fed calves, we have that ability, and we are feeding more milk to those calves. So one benefit. Second benefit really has to do with freedom to express natural social behaviors at a younger age. So calves, cows are herd animals, right? We give them the ability to interact with other calves, develop those social hierarchies earlier in life. And then from a management standpoint, from a human standpoint, we just have a reduction in physical labor. So we have a change in what our managers and our calf experts, calf managers on our dairies are doing, but they're not physically delivering milk to calves. So we have this change in this reduction in labor associated with feeding. However, as we know, those of you who are listening, and those of you who have experience with these systems knows that there are challenges. And the biggest one really is disease, but others include the potential for competition for resources. So we have potentially a lot of calves competing for a single teat. We know that cows are allelomimetic; they like to do the same thing at the same time. So we have that challenge. Again, that disease. We have direct contact between calves, so we have increased morbidity and increased treatment usually in these systems. We might have disease detection delays, so it might be harder to find a sick calf in a group. And then kind of the bane of every veterinarian's existence is cross-sucking. So that's something that we'll chat about a little bit at the end, and I welcome any experiences or questions that you may have about that as we move through this presentation. So the way that I've kind of structured this moving forward is we're going to talk about what is currently understood, or what some recent survey studies and association studies, observational studies, have shown us about health and health of calves in these systems. And then we're going to talk about two sides of the management when we're talking about group feeding calves. The first is introduction, specifically age of introduction. We're going to talk about that a little bit because there's been some recent studies that have kind of changed a little bit those recommendations. And then we're going to also talk about some strategies and some recent studies looking at weaning from these systems. So first, health. So we know group size is a risk factor for morbidity and mortality in group house calves. And these are pretty old studies. So we're talking almost 20 to 25 years old. So the first one here was a clinical trial where they were able to randomize calves into individual, small, and large groups. And they found that once we get over 12 calves per group, we have a big increase in risk for respiratory disease. Those of you who worked in these systems know that this is true. The other risk we have is mortality. And so this is the big, again, the national NOMS data, looking at a lot of calves in a lot of herds and finding again that mortality risk was higher in large groups as compared to single pen or small groups. So that, again, this is why I love pair housing so much, is because we seem to have no difference in health, or at least in the studies that have looked at this between individual and small groups of pairs. But once we get over 10 to 12 calves, then we're in this increased risk category. And certainly if we have these systems, we've installed these in our dairies, we want to maximize our investment. And so as far as I know, companies are still recommending 20 to 25 calves per nipple, but we know that from a disease standpoint, that is not always the best for health in these systems. So what does some more recent literature say? So this is a study that was, the Canadian flag is down here because it was done in Canada. So this was done at Guelph. And I think the farms were within like 2.5 hours drive of Guelph. So in Ontario. And what they did here is they wanted, the goal was to find associations between diarrheal disease and respiratory disease in these automatically fed herds. And so what they did in this study is they visited 17 farms 4 times over a year, hitting each season, which is nice because then we can look at seasonal effects. And on that day, they health scored every calf in the pen to determine a prevalence of respiratory and diarrheal disease. And so important to understand what these pens look like, because they're a little different than we might see, especially here in the upper Midwest. Again, 35 pens on those 17 farms, so 2 pens per farm. This many calves, 1,488 calves, and then smaller group sizes than we have here. So group sizes of about 10 calves per group. And what they found was that the average prevalence on those visits of diarrheal disease was about 23%, of respiratory disease 17%. And what I also wanted to show you is this graph, because I think it's sort of instructive. It tells us some things. So again, here on the y-axis, we have within pen prevalence of bovine respiratory disease and percentage. And then on the x, we have diarrheal disease. And one thing that they found, this R-squared number here, is telling us that they found no association between respiratory disease and diarrheal disease. So that's interesting in and of itself. And then another thing they found is, like, on any specific day, there were some farms that had no respiratory disease and they had, high levels or some level of diarrheal disease, and then vice versa. We have some farms that no diarrheal disease and some respiratory disease. And certainly this is sort of, if we think about any group of 10 of calves, they're going to be of various ages. So that probably has something to do here. And then we have some farms that have kind of a mix of both. So I just think this is an interesting graph that shows that, we have this really big range of health in these pens. And so what they did then is they took a bunch of different measurements on the farm and they asked the question, this farm that has 100% diarrheal disease on this day, what factors were associated with that? Same for respiratory disease. And so what did they find? So they found that so we'll start with respiratory disease. So what factors were associated with respiratory disease? A couple different things. So first was using the calving pen for additional purposes. And this is not uncommon on, small, medium, or even large farms where we might be using that calving pen for sick cows, for other things. And sick cows is really the most common thing, at least in this study. They found that a milk replacer total solids level of less than 10%. So, we want to be targeting at least whole milk levels. So 13% total solids. So if they're feeding less than that, they found that those farms had those pens had higher risk of respiratory disease. if the age at introduction was greater than 8 days, and this is really interesting because this is kind of counterintuitive to what we've been thinking about age at introduction. So calves that were introduced later had a higher risk of respiratory disease. The depth of wet bedding, so the more wet bedding there was, the higher the risk of respiratory disease. And then the air sharing. So if we're sharing air with older calves, we had a higher risk of respiratory disease in those calves. What about diarrhea? What things were associated with calf diarrhea? Again, I'm using that calving pen for additional purposes. And there have been some studies that have shown that salmonella is a big one that is associated with transmission in the calving pen. Feeding probiotics. So if there were no probiotics fed in the milk, calves had a higher risk of calf fed diarrhea. When we talk about, we'll talk in a little bit about machine cleanliness. So farms that had a higher total bacteria count in the milk that they were feeding, which is a lot of times associated with machine sanitation practices, those calves had a higher risk of diarrhea. Running the auto clean of the automatic milk feeder less than 3 times per day. Again, we'll talk about this in a few slides. Sharing air with older calves. Frequency of bedding, so the less frequent, the more likely to have diarrhea. And then interestingly, lack of selenium supplementation. And so when we think about this, we have some commonalities here, right? So again, calving pen for additional purposes, air, so this idea of separation by age and ventilation, and then bedding. So these are the important kind of take homes from this study. So one more study so that was Ontario, so a little further east than what we are here. So what about here in the upper Midwest? This is a study done by Matt Jorgensen. This is Marcia Enders, PhD student from a couple of years back. So they did a big study where they visited farms in Minnesota, Wisconsin, and Iowa every 60 days for 2 years. And they health scored at each of those visits. And then they took a lot of different measurements, and then they associated those abnormal health scores with stuff that they found associated with health in those group pens. So what did they find? So the number of calves per group, so that the more calves per group, the worse the health scores, or the worse the health of those calves. Space per calf, so if calves had less space in the pen, they had more risk of abnormal health score. A low peak milk allowance and an increased time to reach peak milk. And what that is talking about, so peak milk allowance, that would be kind of this blue line that's straight, right? So in this example, the peak milk allowance on this farm, the target here would be 8 liters. And then the time to reach that peak milk, so the longer that was, the more risk of unhealthy calves. So what we would want to do here, so we typically call this the ramp up period. So this would be, in this case, we would be going from 5 liters to 8 liters over a period of 11 days. So we want to reduce that. Airspeed, so ventilation, again, very important. And then again, looking at the plate count of milk taken from the hose from the auto feeder. So again, machine sanitation, very important. So that was disease, right? So that was diarrheal disease, respiratory disease, abnormal health score. What about mortality? And so again, that same study, they looked at mortality in those herds. And so this is the estimated annual mortality. So remember, they're not visiting these farms every day or every week, visiting 4 times every 60 days, so every 2 months. So they had estimated, and they found in this study that the median mortality was 2.6%. And you can see that, like anything on any, given group of dairies, there's a lot of variation. When we think about, it's fairly inappropriate to compare this to like a national average, but we're going to do it anyway. So if we think about the USDA, remember that NOM study again, mortality overall, all calves in the US, we're running at about 6%. So I think that the idea that group housing leads to more calf death. I think it certainly leads to increased morbidity, but we can do an okay job keeping calves alive in these systems. What they do after they are weaned, that's another story, but you know, they're not necessarily more likely to die. And the things that were associated in this study with increased mortality, couple things. So one was a large age range. So the bigger the age range in a group, you know, over 14 days associated with increased risk of mortality. Winter, we know that calves in, you know, in the upper Midwest for a variety of reasons don't always do so well in the wintertime. Small and medium farms, and they thought that was associated with a large age range. So smaller and medium farms have a harder time keeping tight age ranges in those group pens. And then failure of passive transfer. So that is not surprising to any of you, I'm sure. Oh, and then another thing is they found in that Canadian study, the big survey study, that a 4% mortality in those herds. So again, we're kind of in that same range there as what's happening in the US in large groups. All right, so this is kind of our summary slide here, and I thought it would be useful to use a picture. So when we think about this and we kind of summarize all these things, what are the factors that are associated with morbidity and mortality in these group housing systems? So if we think about this individual calf here, when we think about the individual, her age at introduction and her rate of passive transfer or failure of passive transfer is associated with morbidity and mortality. When we think about factors associated with the auto feeder itself, what are those? So milk feeding level, so feeding high levels of milk, good. Total solids level, so feeding higher total solids or at least appropriate total solids levels and monitoring that over time. And then machine cleanliness. When we think about this calf, again, her interaction with the environment, we think about ventilation in these systems, association with older calves, air quality, probably going along with that, bedding frequency and moisture levels, especially moisture levels. I don't have a picture of it, I guess, in this presentation, but especially around the auto feeder, it can get very, very wet because calves stand there, they urinate, defecate in that area. Plus there might be leakage from the milk machine. That's a place that it gets very wet. And then season. So season is associated with all kinds of different things, but certainly in the wintertime, we have different considerations than in the summer. This calf, her interaction with other calves, right? So how does that work? So group size. So again, group sizes of less than 8 to 10 is ideal. Certainly when we're trying to push 20 to 25 calves, that can be a challenge. That's the case in this herd. So this is at least 20 calves in this pen. Our age range, we want that to be as low as possible, from the first calf that goes in to the last calf that goes in a group pen. And our stocking rate, stocking density, space per calf. And then certainly people, so these are some of our students who are here doing some health scoring and some calves in another pen while I was taking this picture, but certainly detection. And we're not going to talk, there's new information really about detection and sort of automated detection, but we're not going to talk about that today. I wanted to focus more sort of on management of these pens today. So just so everyone knows, we want to talk just briefly about machine sanitation. So remember that the milk coming out of these hoses, so this is a auto feeder that's actually getting whole pasteurized whole milk fed out of it. The milk coming out of these hoses, the nipple cleanliness, all important. So these machines typically have 2 cleaning settings. One is a circuit clean, and that's typically, you can associate it like a parlor wash cycle. So it's a full wash cycle. This is something that the producer calf manager has to actually turn on while it's running. No calf can get fed milk. So we want to prioritize all of these cleaning sessions kind of at lull times of day. And typically you're recommending doing that once a day. And then the other kind of wash cycle that happens is not a full wash. it's a abbreviated wash cycle that goes through the mixer. So the mixer that is mixing the milk replacer or adding milk replacer to whole milk, and heat exchanging it. And that it can be set up to run automatically, typically running. We want to run that at least 3 times a day. Some places do a circuit clean 1 time a day, and a mixer clean a couple times a day. And again, prioritizing lull times in the calf feeding sort of schedule. And I just want to briefly describe some data that was, we were a part of my PhD work was a part of this study where we took milk samples from the machine either weekly or every other week for 9 months out of a year, and did total plate counts. And this is the results from that study, the average total plate count over that time. And you can see this is Minnesota, MN 1, 2, 3, 4, Virginia 1 through 6, and you can see this clearly shows that Minnesota is the superior state to Virginia. Just kidding. The thing that was associated with these lower total plate counts were actually number of calves. So more milk flowing through the system tended to make or reduce the total plate counts. And this is our goal. So this is something that I think you can do for your producers, either as a standard protocol or, as a spot check a couple times a year, monthly, whatever. We want our total plate counts to be less than 20,000 and our coliforms to be less than 10. So you can see that some of these farms have levels that are much higher, average levels that are much higher than what we would want. And again, remember that this is important because it's associated with diarrheal disease. All right, so that is what I wanted to say about health, because I think the management thing stuff is new and it's interesting and it's different than what we've been talking about. So we're going to move on to introduction and introducing these calves successfully to the group pen, because that really sort of really sets the stage for these calves to have success on the auto feeder itself. So we used to recommend introducing at 14 days or more. And the reason for this was mostly based on the study that was done in 2007. So we're talking, 14 years ago, that showed that those younger calves really needed more guidance to the milk feeder. They spent less time at the feeder, they drank less milk. And the idea here is that the 6-day-old calves are just not as vigorous as those 14-day-old calves. And a recent study showed that, heifer calves, so heavier calves, so calves that weighed more, again, sort of going with that vigor piece, had a shorter latency to drink voluntarily. But when we think about what is happening in the industry, there have been a few studies that show that the average age of introduction that producers are doing is 5 days. So, the question is, should we wait till 5 days? Should we wait till later? Or should we start thinking about putting the younger calves into the group pen? And really it becomes a question about management and labor, and feeding labor. And do you want to spend your time feeding individual calves or helping calves learn how to drink on the auto feeder? And so kind of with this question, there was a study that was recently published that asked that question. So they enrolled 60 calves and they enrolled heifers and bulls, and they introduced them either at 24 hours or less or 5 days, thinking that 5 days is the industry average. 24 hours is probably, from a management standpoint, if you don't want to feed individual calves, that's probably the easiest, because really they're going on that feeder right pretty much after they finish their colostrum. And so this study was very interesting because they documented calf learning, performance, and then labor requirements. So the labor needed to mix the milk replacer, to feed it, and then to clean up afterwards. And so what did they find? So when they compared those early introduced calves to conventional, or those 5-day calves, they found that the early introduced calves needed more assistance to the feeder. So this is time. So this is, the early introduced calves need 7.8 times where they needed help to get to the feeder versus 5.9. They took longer to learn how to use the automatic milk feeder. Sorry, so overall, so it's not that they took 65 hours of training, it took them 65 hours versus 31. And I think learning, the learning criteria was that the calf went up and drank voluntarily. So once the calf went up and drank at least a liter voluntarily, then they were considered trained. However, the total labor needs were lower. So we're talking total time in 5 days of feeding individual calves, 146 minutes versus 40 minutes. So it took much less labor time to train those early calves. And then they consumed the one sort of interesting finding is the early introduced calves consumed less milk in the first 7 days. And so that is depicted here. So although that happened, there was no difference in average daily gain, and they looked at average daily gain both to 30 and to 60 days. But this to me is a little concerning that we have this sort of reduction in milk intake, and this is when we want these calves to be drinking a lot of milk. So that's one downside, but really, putting them on at 24 hours needed less labor. Certainly we need to have people who are willing, who are patient, and who are willing to help those calves learn how to drink. But it can be done, and so and with less labor overall as compared to those 5-day calves. The other thing that this group, so this is the group from Guelph, they have an auto feeder at their research dairy, so they're doing a lot of really cool little studies to try to tease apart some of these like fairly practical questions. And so the other question that they had was, what is the effect of stall design? So in this study, they had a bunch of calves, 150 calves, and they introduced them at 4 days of age. And they had 2 different sort of feeding stalls, and these are the feeding stalls that you see out on the farm. Most feeding stalls, or at least the ones that I've seen, I guess it's sort of 50-50. So the A feeding stall had those metal bars, and the calf was able to be seen through the metal bars by other calves. And the feeding stall B was sort of solid side. And so the idea here, what they're hypothesized, was that because calves learn from each other, they thought that calves would more easily learn how to drink or more quickly learn with these non-solid sidewalls as compared to the solid sidewalls. And so what did they find? Nothing. They found that it didn't matter. There was no overall effect on calf learning. However, this is the interesting piece, is that so it did matter for some calves. So one thing that I think is becoming more apparent is that there's a lot of individuality when we think about calves and their behavior. And this is a nice reflection of that. So what they did, kind of like very practically and kind of very interestingly, they classified these calves into easy to sort of push into the stall, moderate, so they needed a little bit of help to get into that stall, and difficult, where they didn't want to go into the stall at all. And they found that the calves that were difficult were difficult. It didn't really matter whether there was an open or closed side to that feeding stall. The calves that were easy were easy. They were going to learn no matter what. But there were these calves kind of in the middle, and for them it did matter. And it took them less time to learn and less time for a voluntary drinking meal when the side was solid. So, for some calves, it does matter, but for the overall effects on those 147 calves, it didn't matter. So, what's the answer here? So when we're talking about introduction, the more we thought it was clear cut, 14 days or older, but the more what's happening practically on the farm and, more recent data sort of suggests that there's really no clear cut age answer. And really you're thinking about this trade-off between labor and milk intake early in life, and the amount of time and energy you want to put into feeding calves versus training them to the feeder. And I think for you as veterinarians, I think this is working with these farms, I think it's a real opportunity if you're interested, I guess, because I think this stuff is really cool for protocol development. So, having an introduction protocol, which, maybe includes some measure of vigor, so suckle, maybe finishing the calves are, drinking down their bottles, in a training protocol. So how and when to move calves. Really, most of the practical experience suggests that calves should be moved to the group pen when they're full. So we shouldn't be moving hungry calves, because when you think about what these calves have to do, they're going to be up, they're going to be exploring their environment, everything's going to be new, and you don't want them to be hungry when they're doing that. So moving them, feeding them at night, moving them to the group pen, and then the next morning training or whatever. We want to move these calves when they're full. Okay. So that's kind of the new up to date, and maybe now you're more confused. I feel like I'm confused all the time the more I read, but sort of some up to date information on introduction. And I think the reality is, like, moving calves early is not going to hurt them. All right, so now we're going to talk about just briefly about weaning. So the successfully weaning in a group pen, I think one challenge that I'm sure all of you are aware of is this challenge of cross-sucking. And I have a slide on cross-sucking, but when we're thinking of wean from these auto feeder pens, remember the one advantage that we have is that we can feed large amounts of milk. When we feed large amounts of milk, calves do not eat grain very well, or at least for the first couple weeks of life, they're not going to be eating much grain. So if we're feeding a lot of milk, we have to be really thoughtful about how we're weaning these calves. Make sure we give them enough time for them to start eating grain. So let's talk about slow gradual reduction in milk over time. So this is true, when we have calves held individually in pairs, in small groups, whatever. When we're weaning them, we want this, slow gradual reduction in milk over time. And the beauty of an auto feeder is that we can actually do this automatically. So here's some examples of some feeding plans. And, this is actually, I think this one on the left is an example of the 40 fit plan, which is a plan where calves are on some level of milk, and then they're gradually reduced over a very long time. So this is a 35-day weaning schedule. Here's another example. So this is a farm where they're weaning over 10 days. So from day 35 about down to or maybe 33 down to 42, whatever. It's like a 10-day, 9-day decrease over time. So that's what we're looking for. And I think the big challenge here is that we definitely, depending on the size of the farm, we potentially have calving pressure. So we have a limitation on this. Like, we can't wean calves over 30 days because we need to get those calves weaned and moved on, so that we can refill the pen, or have some pen downtime, some cleaning downtime. So I think that this is an interesting idea. I think most of the literature suggests that we need at least 10 to 14 days over that weaning phase so those calves start eating grain. And there's a recent study that looked at, and this is one study, so I'm not going to hang my hat on it, but they looked at this this gradual weaning. So they did it's auto feeder calves, small groups. They did an abrupt weaning, so total cessation of milk, 6 liters to nothing. And they also did where they gradually reduced over a period of 30 days. And they found and that they concluded that those calves, the calves that were gradually weaned, were actually frustrated because they increased their unrewarded visits. So the amount of times that they went up to the feeder in anticipation of a milk meal, but didn't actually get it. And so that I thought was interesting, but I think I would rather have frustrated calves that were eating grain than calves that, you know, had a big post-weaning slump because they went from drinking a bunch of milk to nothing and did not know what grain was. So again, the reason that we have automatic feeders, we can do this automatically, and gradual reduction will help calves build their rumens. That's what we're really trying to do. So the next step would be grain intake. And so this, you know, when individually house calves, we should be at least offering some fresh starter from, you know, 1 to 3 days of life. Same is true in our group pens. So I like these 2 examples. So this is all these calves laying nicely down. So this is an auto feeder herd. They also have robots for their milking cows. And they have a young calf pen and an older calf pen on the outside here. And they have this grain bucket in readily available for those calves. Same here. So this is a pen of calves, and you can see that there's this nice grain bin that is on the inside of the pen. So on the very right edge of this picture, that is the outside of the pen. So again, putting this grain sort of where a calf will stumble over it, and you know, as they're investigating the pen, investigating their environment, they're going to find it and they're going to start nibbling and realizing that that's something that's good to eat. You know, and then a lot of times this transitions to grain, you know, for cleanliness reasons, that is this fed outside the pen. I will say that if you expect a really young calf, especially a calf that's timid, to put their head through slatted bars, or, you know, be bold enough to put their head through this, you know, that might happen for a month. You might have calves that don't, you know, start eating grain for until halfway through the pre-weaning period. So that's why I like this idea of putting grain readily available so that they stumble over and start investigating it early in life. And so again, we want to prioritize grain consumption and rumen development to facilitate our successful weaning transition. And so this is something that is also brand new. So researchers at the University of British Columbia, they are working on this automatic weaning based on grain intake. And so this definitely means that you have to have an automatic grain feeder, which is not really commercially used, but it's an interesting concept. And so I just wanted to mention it. So this is where, you know, the majority of calves in the United States are weaned based on age. But when you start really digging in the literature, there's a lot of calf-to-calf variation in when they naturally would want to wean. You know, we're talking like months of variation. And so the idea here is that we can wean some. So if calf is ready to wean, we can wean them. If they're not ready to wean, you know, we can feed them milk for a little longer. And so in this study, what they did is they had some calves that were weaned based on age, and then they had some calves that were weaned based on intake, and that was based on, you know, different levels of grain intake. So every time they increased their grain to a certain threshold, the milk was reduced. And so the main take home here is that there were a lot of calf-to-calf variability in both milk intake and starter intake. And there were some calves that, you know, they in this study, they randomized calves to either wean by age or wean by starter intake. And there were some proportion, about half the calves failed. They never reached the threshold of starter intake that they needed. And certainly there are some other issues in this study. You know, walking into an automatic grain feeder is scary. There's an auger that runs, and so you know there might be some other things going on there. But I thought it was interesting to think about, you know, this idea of individualized management. And this could be something, you know, when we think about the calf wearables, the technology that is becoming more available, where we can potentially measure things like rumination. We can potentially, I'm not sure if it's this sensitive yet, but we could potentially measure milk intake versus starter intake, chewing versus suckling. So this might be something that that could potentially be the future of calf weaning. Don't know, but wanted to put it out there. And then what about cross-sucking? So again, this is the bane of everyone's existence. So when we think about what cross-sucking is, like at its core, it's really a function of hunger and failure to express natural behavior. And typically this is what we see starting during the weaning phase. And so when we think about weaning calves in auto feeder herds, that is a real challenge. And when we think about how to prevent cross-sucking, we're thinking about, we want these calves to be have functional rumens, they're eating grain well, and you know, when we don't have any more milk provided to those calves, that they are they're eating enough grain to compensate and not be hungry. I think one challenge when we have a large age spread in an automatic feeder pen, you know, even if it's 14 days, we have some calves that are weaned, and then we have other calves that are weaned or that are still on full milk, depending on what that weaning phase looks like. So, you know, there might be some calves that are, for lack of a better term, triggered to, you know, they hear the auto feeder go, they see other calves up there nursing, they want to nurse, and, you know, what's the next best thing? Suckling on a buddy. The other question I have, and I don't know what the answer for this is it a learned behavior? You know, are calves learning how to do this during the pre-weaning period, and that's why we see it during the post-weaning phase? I don't know. I think there's a lot of questions to still answer. And these are 3 little bull calves that are really nicely providing us an example of cross-sucking. So successful weaning summary. So again, gradual reduction in milk and starter availability early in the pre-weaning period. That's what we really want to do to set calves up. Again, tight age range in the group. We have, again, that idea of less behavioral frustration. And then this other idea that I have, I think it probably has downsides, because if you're removing one calf at a time and putting them in another group, there's social things, there's disease things that happens. But, you know, this question of should we be removing calves as they wean, so that they're not in that group pen and constantly exposed to other calves that are nursing. So again, I think the really important thing to keep in mind as you're working with producers is that, you know, success in these systems is multifactorial, it's farm dependent, and it really depends on a lot of different things. So again, knowing about those different things, knowing what is you know affecting this calf and how she interacts with her environment, other calves, the farm workers, and the auto feeder can help you troubleshoot and can also help you with reducing morbidity and mortality in these systems. And then lastly, I'm just going to blow through these. So we sort of talked about most of this, but, you know, best management practices, and this is, you know, true for all calf systems. So, you know, it all starts with colostrum, right? We talked about restricting milk intake, not delaying that ramp up to peak milk allowance. We know, you know, clean, dry ventilation. Those are the important things when we talk about calves. So excellent ventilation, clean, dry bedding, especially around that auto feeder, around waters, free choice water, high quality starter that is available, readily available to the calves. You know, frequent observations, finding sick calves early, intervening on those sick calves. And then, you know, specific to the large groups. So delaying introduction until the calf is vigorous. And again, there's that trade-off between labor and potentially milk intake. Small group sizes, so that's the one that we often violate. So again, less than 8 to 10 is best. Can work with 20 to 25 calves. It just means you have to do everything that much more perfectly, really. Overcrowding, we don't want to do that. Ideally, managing is all in, all out. And then, paying attention to the auto feeder. Paying attention to cleaning schedules, calibration of the machine, making sure if you're feeding milk replacer, total solids levels are appropriate. I think we have, perfect. We have about 10 minutes left, so I'm happy to entertain any questions that anyone might have.
Thank you. Yes, please, if you have any questions, you can type them in the Q&A area. I do have a question that came in while you were talking, and Dr. Dodd would like to know your thoughts on starter pen for the first 10 to 15 days and then move the calves to an older pen until weaning, and both are auto feeder pens.
Oh, thanks, Dr. Dodd. That's a good question. I think that can work. The thing that I would worry about is the age range and moving individuals. And I know it can be done, but anytime we move an animal to a new environment with potentially new challenge, there's a stress response there. There's cortisol. There might be some potential challenge there. So I think that especially for smaller farms, that works for them, that they have a smaller pen. Or equally sized pens. It depends on the size of the farm, where we have young calves in one side and older calves in another. So yeah, I think it can work, and I don't think it's necessarily a bad idea. I think that one of the things that we fail to think about is that in most of our auto feeder barns, we have nose to nose, across pens. So we think a lot about we want to reduce the age in the pen. The age spread in the pen, but in reality, we might have 8 pens next to each other and nose to nose through the whole thing. So I think we're kidding ourselves sometimes when we think we're reducing potential disease transmission. So yeah, I think that can be a good strategy.
Do we have any other questions? Again, please just type them in the Q&A area. And in the meantime, I want to thank Dr. Knauer for her time and sharing with us her knowledge and experience related to calf auto feeders. And I'd like to thank you, our members, for taking time out of your busy day to learn with us today. As aforementioned at the beginning, we still have 2 other related lunch and learns addressing calf auto feeders. One is on Tuesday, June 8th, and the other is on Tuesday, August 10th. If you're not already signed up for those, you can do so. If you need any assistance, you can just shoot me an email and I will help you with that. At this time, I'm not seeing any other questions. So again, thank you, everybody. Dr. Knauer, do you have any parting words that you want to share?
Oh, I guess just, thanks everyone for your attendance. Thanks to the MVMA and the Food Animal Committee for this invitation. And, if you have any questions after the fact, feel free to email me. And if you want to talk about pair housing, also would love to chat with you about that. So please get in touch with me if you want. And again, thanks for the opportunity to speak today.
Thank you, everyone. Have a great day.